mental and physical health. As the authors emphasize throughout their book, cues of safety shift the autonomic nervous system into a state that supports health-related homeostatic processes and optimizes the social engagement processes necessary to ensure co-regulation and the establishment of trusting relationships with family, friends, and other relevant people. From a polyvagal perspective, the authors provide insights to reach these important goals by emphasizing three core principles related to the theory: maturation, social engagement, and neuroception. Dr. Sanders's work with the high-risk preterm neonates illustrates the impact of maturation on the neonate's capacity to regulate state and vulnerability to cues of threat. From a polyvagal perspective, the degree of prematurity influences the neural resources available to calm, self-soothe, and to spontaneously socially engage. Survival for the newborn is about recruiting a suck, swallow, breath circuit. Without this circuit efficiently functioning, the infant will not thrive. Polyvagal theory identifies the neural mechanisms underlying the suck, swallow, breath circuit as the same neural pathways that underlie the social engagement system. Both behavioral manifestations require the neural regulation of pathways known as special visceral efferent, which regulate the striated muscles of the face and head. The brainstem area controlling these pathways is integrated with the vagal regulation of the heart and bronchi via a ventral vagal pathway. In general, the ventral vagal pathways in a preterm newborn are not sufficiently myelinated to function as an effective vagal brake to efficiently down-regulate autonomic defense reactions. In the absence of an effective vagal brake, cues of threat will trigger a destabilization of autonomic state by recruiting a metabolically costly sympathetic response, observed in tachycardia, or a potentially lethal shutdown response via dorsal vagal pathways. Ventral vagal pathways start to myelinate at about 30 weeks gestational age. As the fetus approaches term, the regulation of ventral vagal pathways becomes functionally integrated in an area in the brainstem that regulates the striated muscles of the face and head. This integrated system coordinates the regulation of the heart and bronchi with the processes of sucking, swallowing, breathing, and vocalization. At birth, this circuit is critical for survival since it enables ingestion and coordinates sucking with breathing. Beyond these ingestive responsibilities, the circuit evolves into the social engagement system. This powerful social communication system enables the infant and caregivers to engage in the reciprocal communication that leads to the establishment of secure social bonds and trusting relationships. Since this system is not sufficiently mature to function in most preterm infants, the natural forming reciprocal bond between parent or caregiver and infant is often delayed or compromised. Without the neural circuit promoting facial expressivity and vocal intonation, the parent or caregiver may feel that their love and concern is not reciprocated. They may express feelings that they love their child, but their child does not love them. This same social engagement system provides the portal for a polyvagal, informed physician to calm their client's physiological state, which will, simultaneously, optimize their client's accessibility to treatment. If a preterm's nervous system detects life threat, then the autonomic nervous system may shift states and move into a dorsal vagal state, in which the heart rate slows, that is, bradycardia, and breathing may either slow or stop, that is, apnea. Physiologically, this state would not provide sufficient oxygen to the brain, which, if prolonged, could result in brain damage or death. Fortunately, the autonomic state, that is, heart rate and breathing, of these vulnerable infants is continuously monitored, and when these shifts occur, medical staff is immediately alerted to intervene. In the neonatal intensive care unit, monitoring the vital signs of heart rate, breathing, and blood oxygenation take the highest priority and function as cues of threat, not only to the preterm infant,